discuss about reversible and irreversible pulpitis. Reversible pulpitis is pulp inflammation which is natural reversible. It can cause of trauma, bacterial involvement, and intergenic factor as well, with short sharp pain lasting for a short time, unlike irreversible pulpitis, and it can relieve after a stimulant removal. Reversible differential diagnosis is irreversible pulpitis and we can differentiate it with the duration of the pain after a stimulant removing. Treatment is removing of a stimulant, so if our stimulant is carriers, restoration is the main treatment. EPT tests and thermal tests are positive, but percussion test is negative. In pulpal disease, and percussion test is negative and no radiographic change in perradicular tissue. Our clinical case: a 30 years old male present with sharp pain when consuming cold beverage lasts for about 1-2 seconds after removing a stimulant. Denies any spontaneous pain, and we can see in a clinical examination a small localized area of demineralization and cavity in the occlusal surface. Radiographic examination shows no evidence of periapical or periodontal pathologies. Irreversible pulpitis: persistent inflammatory condition of the pulp. It can be symptomatic and asymptomatic. Etiology are the same as reversible, and reversible also can convert to irreversible pulpitis. Symptoms: in asymptomatic, we don't have any symptoms and sign, but in symptomatic irreversible pulpitis, we have two stages, early and late. In early stage, we have sensitivity to temperature change, sensitivity to sweet and acidic food, and our pain persists for several minutes even after removing a stimulant. This one is important point. And postural pain. What means postural pain means when we lay down and we can feel a pressure on our teeth. Later stage, severe pain throbbing and nocturnal pain. Nocturnal pain means pain during sleep. Differential diagnosis is irreversible pulpitis. In irreversible pulpitis, a slight pulp exposure is usually present and usually it reaches the pulp. Treatment: root canal treatment or pulpectomy or pulpotomy. Clinical test: EPT can be positive or negative. Why? Because we have inflammation inside the pulp. An EPT test result can be false. Thermal test is positive and percussion test is negative. So we have here another clinical case, a 35 years old male with severe throbbing pain. Pain started spontaneously, sharp, intense pain with hot or cold beverage and linger for several minutes even after a stimulus to remove. Has difficulty sleeping, nocturnal pain, and we can see the radiographic pictures here. We can see in second premolar we have a carious lesion. It's big as well and reached the pulp. So they did pulpotomy. Pulpotomy means removing of the coronal pulp and saving the radicular pulp. So they did pulpotomy, and we can see here we have a healthier pulp and teeth here. So for next video we will discuss about symptomatic and asymptomatic apical periodontitis.